Hi, good afternoon, everyone. We welcome to one more interesting session of Mallapuram. Get more from Mallapuram. Today we are in with an interesting topic which is useful to every woman of your family, your mother, your sister, your grandmother, every woman. So this is Kameshwari from Mallapuram team. Uh, Let me proudly say that we do not represent any insurance company. So, as we all know that every May we have an International Mother's Day celebrated throughout the world. So, in this regard, we are here today with an interesting topic uh, to know about the facts which every woman is going on through. So, today we have Dr. Sophia Aziz with us, who is working as an infertility consultant from 2017 in Anu Test Tube Baby Center. And she has done her MBBS from Deccan Medical College and MD from Shadan Medical College. So I would like to request all the viewers to sit back and enjoy the interesting topic, which will give a better tips and whatever the healthy things you must suggest to your family members, so that it will be a gift. It will be a very good gift to your mothers and all the women all over the world. So I hope this session will give a good chance to you to accomplish your parents regarding their health under 40 to 60, who has to go through a lot of issues. They have to overcome a lot of issues like health-wise and all physically, mentally challenges throughout the age. So I would like to hand over this session to Dr. Sophia Aziz. Hi, ma'am. Good afternoon. We welcome you.
Thank you very much. Thank you very much, Kameshwari. This is really a very good opportunity. And we are talking about a topic that every woman, there is no choice, there is no exception. Every woman goes through it. And I think many of us don't talk about it. And many of them don't know that they have to talk about it. And they don't know how they can get the symptoms down and whatever we are talking about. I hope it's helpful for them. We as women, we have many stages in our life. It's childhood first, then the teenage, then womanhood, the pregnancies, the lactation. And by the time she reaches 30 years of age, 30, the late 30s and the early 40s, she is in a stage where she's very good, reached a position in her career, the work stress is there. Along with that, she's like sandwiched between two generations, the elderly parents who have their own problems and their health issues, and the young children, maybe children who are teenagers or adults going to colleges and all, and they have their own problems. In this stage, the woman suddenly starts having this night sweats, pains in the body, and she's irritable and she has irregular cycles and all. So why does this happen and what can we do about it is something that we are going to talk about today. So hi, I'm Dr. Sophia, as Kameshwari has already said, and under the guidance of my chief consultant and the managing director of Anu Test Tube Baby Center, will talk about gynecological wellness and lifestyle management in middle-aged women. Midlife, typically ages 40 to 55, is a critical transition period for a woman. Hormonal and emotional changes due to decline and fluctuation in key hormones like estrogen and progesterone play an important role, leading to perimenopause and menopause. We'll discuss about perimenopause and menopause and what we can do. How can we get the symptoms down? How can we make the quality of life better for our patients, for ourselves, is something that we are going to talk about. So first we have to remember that women have some important hormones like estrogen and progesterone, and all the symptoms and signs that they are going to show from 40 years of age to probably 55 is because of fluctuation in these hormones and then a decline in these hormones. So let's talk about perimenopause. Perimenopause, you can say, is a way that leads to the menopause. It's a natural transition period before menopause, during which a woman's ovaries gradually begin making less estrogen. It usually begins in the 40s and sometimes even premature in the 30s. Sometimes a woman may also undergo surgical hysterectomy due to various problems, because of which the hormones suddenly come down. We'll talk about it later. So even prematurely, even without the surgery, sometimes in the late 30s, the woman starts showing menopausal symptoms. And when the 40s start, almost like she has started the perimenopause. She shows signs of, like I have already said, that the hot flushes are there, the irritability is there is mood swings, there is irregular cycles. And then this perimenopause is like a road. It's leading you somewhere. Where does it lead you? It leads you to the menopause. So what is a menopause? In perimenopause, you see that the woman has irregular cycles. Sometimes the cycles are heavy, sometimes they are scanty, sometimes they do not come for 2, 3 months, and then suddenly you have a period. And then you start having like symptoms like what we have already discussed, the mood swings and all that. This is because of the fluctuation of the hormone estrogen. The estrogen starts decreasing because the ovaries that were producing eggs in the younger age now do not produce as much eggs as they were producing before, or maybe there is a decline in egg production. So the estrogen hormones, like, it comes down, but then the brain says, okay, the estrogen has come down, and releases a hormone called FSH, because of which there is a spike of estrogen. The spike creates the blood flow, like there is more bleeding, and there are symptoms that are exaggerated. So this is like the perimenopausal stage. And then comes the menopause. What is menopause? Menopause. Pause means stoppage. So 12 months, the woman does not have any period. And then that 12 months without a period, that the stage of 12 months not having a period, is known as a menopause. From that time onwards, the woman has set into menopause. Okay. In menopause, the estrogen is almost not there. And then the progesterone, which declines more earlier than estrogen, is also not there. Progesterone is like a calming hormone, and it declines more faster than the estrogen, because of which the woman has many symptoms, which we will discuss in the coming slide. Okay, so typically between 51 to 55 years of age, sometimes 45 to 55 years of age, the menopause is reached. Perimenopause is before that. So you cannot pinpoint, oh, now woman is going to have menopause now. We can't say like that. Some women say, oh, my mother had it in 55, probably also I may also. There is no genetic correlation, though a little bit, maybe you might mimic your mother's like menopause stage or something like, but usually it happens because of your own lifestyle and your own biological makeup. And also there is no particular time that any one woman can come and ask. Some patients ask, ma'am, when can I have my menopause? When do you think I can have my menopause? That cannot be said, but definitely it might be between 45 to 55 years of age, or maybe earlier, like we have spoken already about premature menopause.
Okay. So, ma'am, we have a question here.
Yeah.
So, what is the matured menopause stage? Someone is
Sorry?
asking that. Matured menopause stage.
Mature menopause stage is nothing like a mature menopause stage, to tell you, Kameshwari, because everybody is different. Okay, every body is different. But once you cross 40 years of age, okay, you start having menopause. But 45, you can say, yeah. From 45 years onwards, you can say that, yeah, it's a mature menopause stage.
But ma'am, I have a doubt here. Actually, when we missed a period, apart from all they had kids and all, if I'm there, so I missed 2 months of period. So can I consider it as a menopausal stage, or it maybe have other things to be considered?
See, actually, the thing is, Kameshwari, when a woman has 12 months, she does not have a period. Okay, she's 50 plus years of age. So you can say that she's set into a menopause. In perimenopause, you can have irregular cycles because of hormonal disturbances, which we have already spoken about. And you're saying that if we don't have period in between, should we take it as menopause? No, you can't take it as a menopause unless you do not have period for 12 consecutive months. Okay. So here we have a chart in which we can differentiate between perimenopause and menopause. Perimenopause is like a transition period, like it's going on. Okay, it is going on and it is going to stop at the menopause. Whereas menopause is defined as 12 months with no period. Okay, clear? Then the hormones in perimenopause, they fluctuate. There is estrogen, there is progesterone, they fluctuate. Like progesterone is the one that comes down because there is no ovulation. So the progesterone, there is no corpus luteum formation. Corpus luteum is something that will produce a progesterone. That is not there anymore. So the progesterone comes down more quickly. And the estrogen, it has spikes. It goes up and comes down, depends on the FSH that is produced by the brain, because the brain says, oh, estrogen is going down, let me produce this hormone, follicle stimulating hormone. And then suddenly estrogen goes up and the woman has more bleeding. And because the progesterone is less, the bleeding is prolonged. It can be heavy bleeding. It can be for a longer time. And sometimes the woman does not have bleeding for 3 months, and suddenly she has her periods which last for 2 weeks or even 3 weeks. Women come to us saying that I have this long bleeding, what should we do? This is because of spike of estrogen. So hormones fluctuate in perimenopause, whereas in menopause they have declined significantly. There is no progesterone and almost very nil estrogen. Then there is irregular periods. In perimenopause, like you have just asked me, whether if the woman does not have period, should we consider as irregular cycles? Maybe menopause? No, we can't. Till 12 months, if she doesn't have period, that means she's not set into menopause yet. Maybe in this early 40s or late 40s, when she is setting into the menopause, like she's in the perimenopause period, that time for 3 months she might not have period, and she might think, okay, maybe I've set into menopause, but then she has a period. Okay, so that is a perimenopause period. So we have seen your irregular cycles period, and then menopause periods have completely stopped. Then symptoms begin and vary. Like they begin, and so every day she doesn't have a hot flash, or every day she's not irritable. It depends on the estrogen hormone. Now, here I'd like to add that estrogen is a very important hormone. Usually, when we say estrogen, we think that it is only concerned with our uterus. But estrogen receptors are everywhere in the body. It is in your urogenital part, it is in your muscles, they are in your bones, they are in your brain. That's the reason we have so many symptoms when this estrogen hormones is fluctuating. Okay, so this one I wanted to say then. Now, what are the symptoms of perimenopause? Like I have told you, there's hot flashes. Hot flashes is something like a woman feels like she's feeling hot from the chest upwards. She has sweating, and the body gets hot, and she has a lot of sweating and all. And this hot flashes usually happen in the night. Okay, so our estrogen, it also controls hypothalamus. There is a thermostat that controls the temperature of our body. When the estrogen comes down, this thermostat is not stable. Okay, because of unstable estrogen, because of which the temperature of the body, it goes up, and then you start feeling this hot flashes. It lasts for 2 to 3 minutes. When the hot flashes come, many patients do think, oh, am I getting a heart attack? Oh, is it like line? So
I was about
we
to
mix
ask
like
about this.
yeah.
Correct.
But in heart attack, yeah, your pain in the chest is different, and then there is other symptoms that come. But in perimenopause stage, the patient should come to a doctor, take counseling, like what all she can expect, like in hot flashes. The other is mood swings, mood changes. Like I have already told you, there are receptors in the brain. Okay, so when there is any, estrogen comes down, the mood changes. So a woman might get irritable. She might get angry over small things that before she didn't never used to get, and she feels that her temperament has changed. Okay, and she feels that she doesn't want to do something. She feels lethargic. She feels irritable when the kids come and bother, and then you start hearing this in your own household that, Mama, why are you getting angry on everything? And the husband says, I'm seeing nowadays your mood has changed. But no one really knows what's going on inside the body. Okay, so family support, Kameshwari, is a very, very important. Your husband, your children have to understand what you're going through, but they will never understand that unless they know what you're going through. They don't know what's happening. So counseling of the family is as equal important as for the patient, so that the husband can tell his wife that, oh, I'm there for you. Okay, I know what you're going through. Be a little patient with her when she's going through. Do things that make her feel good. And then sleep disturbances. Like I already told you that because of estrogen coming down, there is changes in the brain, and the patient does not get the sleep as she used to. And then progesterone is also important for that. Progesterone actually is the hormone that calms you down. Okay, but then progesterone is already over in the perimenopause. In menopause, definitely it's not there. And then estrogen spikes, that hot flashes and all, they keep you awake in the night. And here I would like to add one more thing, Kameshwari, that hot flashes can happen even in the daytime. Okay.
Oh,
Sometimes one of my friend, she told me that I was sitting, she's into IT jobs. She said I was sitting on the desktop and I was doing my work, and then suddenly I started having this feeling of, sweating and like chest onwards, and I was sweating for some time, for 2-3 minutes, and then I was back to normal. So these hot flashes can even happen in the daytime. And then she called me and she said, "Do you think it's a heart attack?" So I said, "No, it isn't, but we shouldn't rule out. We can't say, okay, it's just a hot flash. Go to the doctor, get an ECG done, get your blood tests done that are required for, and rule it out." And then osteoporosis. This is one risk that is there when the estrogen comes down. Because as I told you, estrogen is also found in the bones. It helps in the formation of bones, a calcium deposition in the bones. So when the woman is going through menopause, this estrogen comes down, so deposition of calcium also comes down. She's at a risk of osteoporosis. And what to do about it will, know later. Heavy or irregular bleeding. This also I have told you that when there is like when the estrogen spikes are there, the woman starts having a period again. Then the estrogen comes down. Then for 2-3 months, she does not have a period. And then vaginal dryness. This is one thing that, women feel shy to talk about, that they feel shy to say that I have vaginal dryness. Because of vaginal dryness, infections are rampant. She might have infections. Other thing, the intimate life of a woman also comes down. She does not have the libido, she does not have the urge to have intercourse. Then there is a problem between the husband and the wife that, oh, you're always saying that you have this pain. But it does happen. Vaginal dryness does happen. So, but there are many things that we can do for vaginal dryness. Though not completely cure, but there are some lubricants, hormonal replacement therapy, which will later. But there are things that we can, but also the husband should be counseled that because she's going through all this, you have to be more patient and you have to understand, and then things will get better. Weight gain or slow metabolism. Estrogen is a hormone that actually helps the fat to be distributed at the right places. Okay, your hips, your thighs, and on different parts of the body where it has to be for a woman. But when the estrogen is less, you have fat. You will see that when women in 40s, they say, मेरे पेट पे ज्यादा चर्बी जमा हो रही, like my stomach looks bigger. You will be hearing that from many people. Okay, my stomach looks bigger now after she crosses out, because the fat deposition now, because of insulin resistance, is mostly on the tummy. Okay, on the stomach, because of abdomen. Because of this, there is insulin resistance also. You see how everything is connected. Insulin resistance. Because of insulin resistance, the HbA1c goes high. Insulin resistance makes the patient prone for diabetes. Okay. And then there is so metabolism is also reduced. The kind of metabolism you had in your 30s, your early 20s, your 20s, early 40s, maybe also you might have a good metabolism, but then it comes down. Okay. So, but there are ways to get the metabolism high. We are going to go for that. And then there's urinary incontinence. Like I told you that there are receptors of the estrogen, not only in the uterus, they're also there in the urinary tract. Okay. So what happens is that now that estrogen has come down, the tone of your urinary bladder, your urethra, everything comes down. Okay. So you will not have that kind of tone, that tightness and everything that, it controls your bladder or controls your vagina. Your vagina seems to be a little lax, and your urethra and also become loose, and the tone also goes away. So this is because the receptors, there's no estrogen. And then you will have something called incontinence. Okay. Incontinence, stress incontinence, or urinary incontinence. So the woman says when she is in a 45, 50, like she will say that by the time I reach the washroom, I pass a little bit of urine. Okay, I'm not able to control. When she laughs a lot, she feels that something has passed out. Okay, some urine has passed. And when she coughs, she feels a little urine has come out. This is because of the laxity of that, genital area, because of estrogens. Okay, so this is what we have. Perimenopausal symptoms. Menopausal symptoms also are very close, but they are
one more small doubt, ma'am. Actually, irregular periods, it can be 2 months, once a period after 2 months. But can it be twice in a month also, ma'am?
Yeah. It can be twice in a month. That's a very good question, actually. Yeah, irregular period doesn't mean that you're going to have it every 2, 3 months. Irregular period also means that you might have a irregular kind of cycle. It can be once in two, twice in a month. It can be like 3 months you don't have a period. Then for 15 days you're having a period. Then again you may be having spotting, and then you may be having the real bleeding. So there are many patterns, Kameshwari. So depends on the hormone, like how it's secreting. So that hormone decides, okay, now you should bleed for these many number of days. Okay, now you stop because I'm not there anymore. So you don't have to. Yeah, what you asked is right. It can be twice in a month. Okay. And then the symptoms of menopause. And one thing I want to add Kameshwari, in this is that definitely irregular cycles, you're having bleeding twice a month. This is all related to estrogen, but there are some physical factors, you can say, inside our anatomical factors inside the uterus. Sometimes there is a polyp, sometimes there are fibroids. These are also the things that the bleeding might get a little bit abnormal. So definitely any gynecologist you go to with irregular cycles or with spotting or with periods twice a month, she will first ask for an ultrasound. Okay. Ultrasound will help us to know if there are any fibroids inside, any polyps, cervical polyps, uterine polyps, that are causing some kind of bleeding or spotting in between. So that is one thing we have to rule out. Another thing, these are the symptoms of menopause. If you see here, hot flashes are there, even in perimenopause, menopause, and in menopause there is sore breasts. You feel that the breasts are like sore, they are painful. Insomnia, in both the cases, insomnia is something that every 9 out of 10 women in that period, they say that, yeah, we have insomnia. And insomnia, we should have empathy for the patient who say insomnia, because we are working, Kameshwari, when we don't sleep in the night, you know how the next day goes. We are always disoriented. Somebody calls us also, we feel irritable. So it changes the quality of your life if you are having insomnia. Then reduced metabolism. Definitely, we spoke about estrogen, how it comes down and the metabolism comes down. It makes us gain weight. Okay. Brain fog. This is also an important thing. If you have noticed, sometimes when we are talking to a patient and suddenly we want to tell them a medicine and we have this brain fog. Oh, what was that medicine? Like that. Even though we have practiced so many years and we know like it, and then you call your servant and then you just forget what was her name. Oh, and then you don't want to look strange and you say, "Acha, tum aa jao, andar aa jao." You want to call her in the room, but you forget the name. It's not like a permanent thing, it's a transient thing. Okay, brain fog. And then anxiety and depression. If you see in the perimenopause, usually the woman has more anxiety, irritability. In menopause, it's more depression. They feel depressed. Okay, they feel sad. This also, definitely because of the receptors in the brain, they are having this neurotransmitters which are being released, but also happy hormones are not there. And then this depression, because she feels that, oh my, this is the end of my life. Oh, I have completed my I have stopped my period, so I cannot reproduce anymore. So probably this is the end of my life. I'm aging now. So this is a wrong notion, and this can be corrected with counseling, with so many other things that can help. Okay, and hair loss. Hair loss is also hormonal.
Excuse me. Actually, we were discussing about depression. We have a question here from Mariam Shanwa. My friend is very moody and irritable these days. She's 45 years old. Do you think it's menopause that she's going on through?
Yeah. So, hi, Mariam. That was a very good question. And I also have a friend, her name is also Mariam, and she's kind of very sweet. Okay. Also, whenever she has irritability or depression, she calls me and speaks to me. So, I can say that when you have depression or anything like that, it's always better that you have a good circle of friends around you. Okay. A good circle of friends whom you can talk to. Okay. You can talk about your symptoms. That really gets the symptoms down. And then you should have good support groups, like where women of the same age, they meet and they tell, everyone tells their own problems. So you don't feel, okay, I'm the only one. So usually when we have any problem, we always start feeling, oh, am I the only one? Why is this happening only with me? It's not happening only with you. It's happening with all the women around you. Some may have some symptoms, some may have some other symptoms. Lucky ones may have less symptoms. The unlucky ones may have more symptoms. Okay, but it is a transient phase. So if you ever feel depressed, Mariam, they always many things that you go, please meet your friends, talk to them, have tea with them, enjoy with them, do your hobby, anything you like doing, come out of the house. And the most important thing, your lifestyle. You have to have a good exercise routine. You have to have good diet that contains nutrition, a balanced diet that will help you come out of your depression. Have some hobby, go do things that you like. All these things can help in depression. Along with that, this irritability and all could be because of things happening at home. So the family should also be counseled how to take care of the woman. And
So
then
we have from same Mariam, we have another question now. Till what age can a woman get pregnant?
till what age?
A woman can get pregnant.
Oh, yeah. So
A woman
that's an
can get
important question, Mariam. See, many a times after completing the family, nowadays people are going for tubectomy and a complete family planning thing. But if you have not had a family planning and you're happy to have children till whenever you want, so we cannot say anytime you're ovulating till 50 years of age, you might have your children. Okay. So we cannot say. If you are not ovulating, then we can tell you. But because of the progesterone declining, so the ovulation might not happen. That's the reason. Could be that you might not get pregnant, but whether you will have ovulation or not till you reach the age of 50, definitely anyone can get pregnant if you have ovulation. But once you reach menopause with 12 months of not having pregnancy, then you can say that this is the time. Now it's over. Once you reach menopause. And Mariam, if you want to have more children, you can always come to Anu Test Tube Baby Center for a consultation. Okay. And the next one is risk of cardiovascular diseases. Okay. We've spoken. Cardiovascular disease is one important thing because, as I have told you, estrogens are present everywhere. You'll be surprised to know they're also present in the heart, in the SA node, everywhere. So, when the estrogen decreases, there is always a risk of cardiovascular diseases. Okay. So, a woman should go for heart checkups, like lipid profile to check the cholesterol, and sometimes once in a year for ECG. Maintaining a good lifestyle will help. Okay. So now perimenopause.
Can we postpone menopause? Are there any therapies or some treatments are there to postpone menopause?
So, Kameshwari, I can tell you one thing that postpone the menopause in the sense if your mother has a late menopause, you can also have
correct.
Postponing a menopause means I can't tell you whether you can postpone a menopause, but definitely there is a study that's done. If you have more of caffeine, okay, alcohol, smoking, and obesity, all these are linked to an early menopause.
Okay.
You see what I'm saying? That if you have a good lifestyle, okay, somebody like you who's very fit and fine and smart, taking care of her diet, taking care of her exercise, sleep pattern, everything. For these people, it will come like gradually, physiologically, and the way it should happen at a certain age. But women who do not have a good lifestyle, who do not do take a lot of alcohol, whatever, if lot or less, we cannot say alcohol, but they are regularly taking alcohol. They are regularly taking caffeine, thinking that, okay, caffeine is very good for me. It's making me lose weight or it's getting my metabolism high. No, caffeine should be reduced. Alcohol should be reduced. So caffeine, alcohol, obesity are related to an early menopause. So maybe if you have a good lifestyle, maybe if you would menopause at 50 years, probably you might menopause at 53 or 54 years. You never know. Okay.
So this is a hereditary. This can be a hereditary which continues from generations to generations.
No, Kameshwari, it might not be like that. Okay. Maybe there is a few factors that, if your mother's been fit, she's been meditating, she's been doing yoga, she's been eating good food, she has menopause little late with very less symptoms. Okay. But that is her lifestyle. Okay. You are saying that I will have caffeine, I will have alcohol, I will become obese, but because my mother menopause at 55, I will also hit. No, it's not going to be like that. Some things can be hereditary, but not all. So there are many people ask, can we do some blood tests to know whether we are going menopausing or whether we are in the perimenopause stage and all? Usually menopause and perimenopause depends, any doctor, any gynecologist can tell you by your age, your symptoms, she can diagnose you to be in a perimenopause or menopause.
Okay.
But still, if you want to get some of the tests done, there is FSH level. I have already told you when the estrogen is low, follicle
Yes.
stimulating hormone increases.
Mm.
When follicle stimulating hormone increases, you can get a follicle stimulating hormone done. And when the levels are high, okay, I am going into menopause because my estrogen is going down. That's the reason FSH is high. Then estradiol levels, which are decreased, you will come to know your menopausing. Then thyroid. Thyroid is one thing that mimics some of the, what do you say, some of the symptoms of menopause,
Oh.
putting on weight, and then insulin resistance, and then slow metabolism, and you feel lethargic. Okay, so you should get a thyroid done also to check your thyroid levels. And when you reach menopause, it's always good to meet an endocrinologist because thyroid hormone can also fluctuate along with the estrogen. Okay, and then there is vitamin D and calcium. This is very important, Kameshwari, because the osteoporosis risk is high. Okay, once the estrogen stops, the woman is more prone for osteoporosis. Okay, before osteoporosis, there's something called osteopenia, which will tell you that you can go into osteoporosis soon and all. This is the first stage. So if you get a bone density test done, it will show you how much of a bone, bone density, how much loss is there, and how the bone density test comes and how the values and all. So you can start taking more vitamin D and calcium and foods which are rich in vitamin D and calcium. Besides this, exercises. Besides this, the lifestyle changes are very important to have a good, bone health. And the other thing is lipid profile. Like I told you that women is more prone for cardiovascular diseases in this time. So lipid profile is important, okay?
Yeah.
The
So
cholesterol levels.
how often a woman should go for routine gynec checkups, ma'am?
So gynec checkups are whenever she has symptoms or yearly once. If she has too much of like night sweats, she has too much exaggerated symptoms and all, she should definitely meet a doctor so that she should not suffer in silence. Like she's getting up in the night with hot flashes and all, she's having other problems which are exaggerated, too much of dryness of vagina and all, then she should. Okay. And there are other things that I'm going to tell when she will have to meet the gynecologist. And then HbA1c is important, Kameshwari. HbA1c will show you how your sugars have been doing all this while. HbA1c is actually done once in 3 months. Okay. So 3 months, how your sugars have been doing, you will come to know once you get HbA1c. HbA1c more than 6.5 or maybe more than 6 in some labs, then it shows that you are in your pre-diabetic stage. So from pre-diabetic onwards, you should be on some medication. And if you have strong history of diabetes, then you should start with the medication. Otherwise, lifestyle changes by 6.5 can revert back the diabetes. Okay. These are the tests usually we ask you to do. Then screenings. When a woman is in a menopausal stage and because of aging, we also have a risk of cancers, malignancies and cancers and all. Okay. So we recommend that you go for breast examination yearly. That is called mammogram. Okay. If you have a history of breast carcinoma in your family, then it is every 6 months you can go for a mammogram, or you can go for mammogram yearly or biennially, once in 2 years. Okay? Depending on your history, depending on whether you have any symptoms or family history or whatever. So mammogram is a kind of test that can reveal if there is anything inside. Then there's cervical cancer risk. So cervical cancer HPV test can be done every 5 years, 3 to 5 years. Okay. There's something called pap smear also. And pap smear, if there is any infections or malignancies also, it will be there. But it can be done even in young women, like from 36 years onwards. Okay. But then HPV testing, that is the cervical cancer, you can do it every 5 years. Or you can co-test every 3 years also. Okay. And then cancer screening for colorectal cancer, that is also a kind of cancer. Colonoscopy can be done. And the bone density test that I have told you. These are the things that you can do annually. Okay. Bone density test is very important for us to know if you are still in the first stage of osteoporosis, gone into osteoporosis, what else can we do? Because once you reach, after the estrogen is stop, like it already all stopped in the menopause, the women, as the woman is aging, there are chances of fractures. Okay. So already you're going through all this and then you have fracture and also it disturbs the quality of life, So it is better that from day one, I mean, whenever you feel that now I need to take care of my bones, you should start
Well,
with a vitamin D test and start with the calcium and
mhm.
foods rich in calcium and vitamin D.
Okay, okay. Here,
Then,
I remember one thing, ma'am. One of my aunts who was 70 years old, she was having a spotting when she went to urine actually. So after that, she was gone through this pap smear test, and she got nothing. She got a negative report. But is it possible for 70 years old to get spotting and
see, actually, Kameshwari, the thing is that postmenopausal bleeding is a concern. Okay,
okay, okay,
postmenopausal bleeding is a concern. Mostly if there is endometrial carcinoma or
hmm,
anything to do with any genital carcinoma, there is spotting per vagina. Okay,
okay,
but there is another thing also. If the woman has some kind of a polyp in the
hmm,
cervix, polyp in
okay,
the uterus, okay, that can also bleed. Okay,
oh,
some trauma, some polyps that can also bleed. So if you say that it was negative, probably it was some other reason, like a polyp
correct,
or something, which can be removed. Okay,
correct,
that is an easy thing. You do a hysteroscopy, you remove the polyp, or you just take out and then whatever curettage comes out, I mean, you send it for histopathology examination. And if you detect any kind of abnormal cells and all, she can go for a hysterectomy also. But
oh,
in that age, it's better you meet a gynecologist and take an opinion whether how
correct.
much it is needed at that
Correct,
stage.
correct.
Okay,
After
and
it,
then.
she had some medication and she's fine now. But at that age, we were shocked that she got spotting and all. And also, she
Oh,
got the trauma of some 2 weeks. Apart from that, she was so shocked and she was so scary that I got this one. What happened to
yeah,
me? Is it some kind of a cancer? That's
yeah,
what her thoughts were actually. So
yeah.
now she's fine, but
Okay.
we got a doubt.
Yeah, but having said that, it's always better that every 6 months you get a checkup done for her,
Correct.
just
Yes, ma'am.
like to rule out if there is anything changing inside.
Yes,
Okay,
yes, yes.
all right.
So
So
we have a
and then
question here, ma'am. What advice would you give women who are afraid of menopause?
so, see, I would tell you that this is a transition. This is a period that every woman has to go through. Okay.
Correct.
First and foremost, most important thing is your mindset. Okay.
Mm,
You should have a mindset. People think that menopause means end of life. Now I'm not reproducing anymore. I've become old. But
mm,
that is a beginning of a beautiful phase in your life. You're
correct.
more graceful now. You are like more in control of your life. You can take your own decisions, and this is
Mm,
not something that is happening only for you or for me. It will
mm,
happen with every woman. See, when you had your periods, you will not say, oh, why did I get my periods? That is a
mm,
normal phenomenon of life.
mm,
Excuse me. A normal phenomenon of life. And then when you are childbearing and you have your children, you never say, oh, why is this happening to me? It's a normal thing. Every woman has to go through menarche and then the childbirth, the perimenopause, the menopause. Every woman has to go through it. You have to
mm,
change your mindset, thinking
mm,
that, oh, this is the end of life, which I thought this topic I'll talk to you a bit later. But then
yeah,
because you've taken it up, you have to
correct.
change your mindset. I'm
Mm,
afraid of menopause. What are you afraid of? You are free of your periods. You don't have to worry to go anywhere thinking, oh my God, when you have your period also, you're not satisfied. Oh my God,
correct.
PMS, what am I going to do about it? I'm in too much pain, I'm having nausea, I have mood swings. So there
Mm,
also there's a hormonal factor. But
correct.
then when you don't have periods, you're more free. Go out with your friends, enjoy with your friends. You can
Mm,
have a active sexual life with the feeling that you might not, you're not going to get pregnant. Okay. So
mm,
then other things that now you are in your stage where you can take your own decisions and you can be like really happy thinking
mm,
that you're in another stage of life where you are going to have your a different set of rules, a different set of life. I mean, a different set of enjoyment, and whatever you want to do, you can do at that time. It's not just a
correct.
cessation of period. There might be some symptoms and all, which might also go away with a holistic, good approach and
Mm,
positive approach. You can
correct.
restore your energy also. So
Mm,
mindset is very. I would
correct.
say that to all the women who are afraid, please change your mindset regarding menopause. Everyone will go through it. And if you take it positively, the symptoms might also come down. And actually, you'll realize that is one of the best periods of your life.
Mhm.
So
Correct.
now we are talking about lifestyle management. So we've spoken about healthy diet. Diet is very, very important factor.
Okay.
Healthy diet is not like some people just stop all the carbs and they just take this do some keto diet, they do some other diet.
Mhm.
Diet is not like only this diet, only that diet. Okay, intermittent fasting is good, it will help. But being hydrated is very, very important. Okay,
Mhm.
diet that contains more of protein. Okay,
Mhm.
now when we say protein, the vegetarians they are saying like thinking what protein we should take. All dals, all kind of dals. Okay, there's soya, there's paneer. Okay,
Mhm.
so many things. Yeah, chickpeas. Okay,
Okay.
lobia. There's kidney beans that you can take. And then protein, high protein diet, more of fiber, less of carbs. This
Okay.
is should be the balance. Okay,
Mhm.
it's not like okay, I will just take protein. I will not take
Mhm.
fiber. Then that's not a good diet.
Correct.
Equal amount of protein, equal amount and more of fiber, and then little amount of small amount of carbs should be involved.
Mhm.
Okay. Now,
So, what about fancy diets like some these days we are more aware of millets and such kind of diets, no? So,
fancy
will they
diets are not
help
a
taking more of quantity? Mhm.
fancy diet in the sense you're saying that some kind of um, For me,
Millet,
fancy for
correct.
me, fancy diet is mostly biryani, actually, Kameshwari. When I think of fancy diet, it's mostly biryani and the red chicken and whatever. Fancy
Okay.
diets, actually, if you see people who want to lose weight and want to go for fancy diets, it's not consistent.
Mhm.
After some time, they start losing interest in that diet. Whereas if
Correct.
you go for a balanced diet, then
Mhm.
that is something, it is a consistent thing. You can take it daily. Okay. When
Correct.
you're sitting for food, you can just take out one roti. If you have
Mhm.
two rotis in your plate, take out one roti. If you have more rice, take out half the rice and put more of the, like, chicken is there or dal or curd. Just
Mhm.
prebiotics. Yeah, prebiotic is an important thing. You add that and you take out.
Mhm.
This is a consistent diet. You can do it every day. If you do a special diet, a fat diet, something that's like, fancy, you do it for some days and then you start feeling, oh my God, I'm missing my dal and roti. I'm missing my rice and chicken. So just make it something that becomes a habit, a
Mhm.
consistent habit. Okay.
Mhm.
And then managing alcohol and caffeine. As I
Okay.
have already told you, alcohol and caffeine are not good for many things. First and foremost thing that they have their own side effects. The other thing, it can lead to an early menopause. The studies are still going on. And then it might also keep you awake. One of the very big symptom of perimenopause and menopause is sleeplessness, insomnia. So if you have caffeine and alcohol, it keeps you active. It keeps you like, edgy. It keeps you, no, insomnia will increase. Okay. So it will keep you awake in the night. It is not good for you at all. So get it down. Also, it is not good for you because the cardiovascular risk is increasing. Okay. So cardiovascular risk, insomnia, so many, and that irritability, mood
Mhm.
swings, they also increase with alcohol and caffeine. Okay. So it's better to get it down and then regular exercise. You're okay?
Yeah, ma'am. Okay.
Regular exercise
Mhm.
is important. Regular exercise is important. Even I have to do it. So I'm
Okay.
telling everybody, let's do it. So
Mhm.
regular exercise is also like walking. Okay. And then there is training. Strength
Mhm.
training. Either you do it with weights, you do it with bands, you do it with your body weight. And aerobic exercise works like magic.
Mhm.
Aerobic exercise, you walk, you swim, you jog, you dance. Okay.
Mhm.
All these things. Yeah. And dance, I'm saying, Kameshwari, because many people enjoy dancing.
Correct. Correct.
Many people enjoy dancing. You put a music, you don't have to dance like a pro. You just
Correct.
move your body and that's it. Move it for 30 minutes, okay? And you don't have to feel shy. Like, nowadays you can take the phone inside your room, put a song you
Ah,
like, and then start.
correct.
Okay? And
Yes.
then maybe 30 minutes of that aerobic exercise, 150 minutes per week of
Mhm.
aerobic exercises. And
Okay.
this what do you say, strength training exercises will
Mhm.
go a long way. It really,
Mhm.
really helps because not only are you losing your bone, also you're losing your muscle mass. Muscle mass is also so protein plus, good diet which contains more of protein plus
Mhm.
your like lifestyle. Okay, your
Mhm.
lifestyle that exercises that help you build the muscle mass will also help.
Mhm.
And then stress management.
Mhm.
Stress is very important. You're
Correct.
working, Kameshwari, you know what stress you have at.
Yes, ma'am.
Okay.
And also I remember this when we came to your hospital to meet you. So we were just discussing about this phase of a woman, 40 to 60. She deals with everything. She should take care of their family, children, parents, parents-in-law, self-care, everything. So how can a woman balance all these things, ma'am, at a
Yeah.
time?
Yeah, true. Stress is an important factor,
Yes,
Kameshwar, whether it is at work, because at between 40 to 50, a woman has reached that kind of good position in her career, but it also comes with a lot of responsibilities. Okay,
correct.
that is one thing. And then
Mm,
the family life, the family concerns, like, ailing parents, like aged
mm,
parents who are sick most of the time, and their
correct.
own, this thing, tantrums, they might have their own tantrums, they might have their own, demands and all. And young children, teenage children, you know how the children are. They also want you, and they also don't want you. Okay.
Mhm,
So,
mhm,
a woman is like sandwiched between these
correct.
two generations, the younger one, the demand, and the older one. You
Correct.
love both of them so much that you can't leave them. But the
Correct.
stress it gets in that stage of your life, when you're already undergoing so much of changes in your physical, your mental, your
Ah,
emotional
yes.
way, you're changing, and you yourself need support. You need somebody who understands you. You need
Correct.
somebody who says that, okay, it's fine, we are there with you. In that stage of life, you have so many other things:
Mm,
managing the house,
correct.
managing the servants,
Correct.
managing your work, the
Mm,
managing your staff at the workplace,
mm,
managing your patients, and managing your family, your elderly parents, your young children, your partner, so many things together. So
mm,
stress is an important factor. How to get it down? Definitely there is counseling, there is
yes.
exercise, there is diet, and a me time. You should have a me time. Okay.
Mm,
If you are a good painter and then you got married and then you had children, you left the painting, you draw in your children's projects and you feel happy, okay, I'm
correct.
doing a good job. You're not
Mm,
doing a good job. Do it for yourself. Okay. If you are a good painter, you just get a set of paints, you can get a canvas and start painting. You're a good dancer, 1 hour in a day, you just go out of the house, join something and you dance, or in your room, that's your me time. Okay. And then spending time with your family, spending time with your friends. Some people have very good, network of cousins where they sit and they talk, they laugh. That is once in a week you do that.
correct.
And with your friends, okay, whenever you feel like you have time this weekend, or just plan a sudden getaway. Like,
Mm,
in somebody's house, you go to a picnic, you go somewhere, have a good time. All these are stress busters, okay?
correct.
And
Correct.
then the family. The
Mm,
family also has to have, you have to sit with your family. You have to tell them
mm,
what you're going through. You have to
correct.
tell them. They also love you the same way. It's not that they don't, but they don't know what's going on with you. How will they help you out? So you have to counsel them. See, I'm
Mm,
going through this phase and I need you to understand and support me. Definitely, they
correct.
will not ignore it in
Mm,
whatever way they can, little or more. This is going to help you a long way, because now they understand, oh, my mother is going through this. I should
ah,
be a little more like responsible for myself, so that my mother doesn't get this problem.
correct.
The husband should understand that, oh, my wife has always taken care of me, my parents, my children. Now this is the
Mm,
time she needs me. I should stand by
correct.
her. So
Correct.
counseling of the family and counseling of the children, like family, and then spending time with your friends, having a hobby, all these things will get your stress down. This will
Mm,
also help
that
in
is the
your
reason maybe these days we see a lot of kitty parties going on. Maybe it is
yeah.
one of the reason.
Yeah, I just
Correct.
had it last week.
Acha. Oh, good.
Yeah, it does help. When you
Yeah,
sit with your friends and you laugh and you just,
correct.
talk about everything, and there's one friend who comes up and says, Sophie, and if you're the only doctor in your group, or if you have some group where you don't have your professional friends,
Ah,
but they are so much fun to be with. You don't have
correct.
to talk professionally all the time. So one of them
Mm.
comes and says, I'm having these symptoms. And then I say, oh, I'm also having them. And I laugh. And then it looks like, oh, this is all normalized, like that.
Correct.
And the next is adequate sleep.
Mm.
We have spoken about sleep. There are
Correct.
certain things that I want to tell you about sleep, that though, we have spoken that there's stimulation in the brain, in
Mm.
the thermostat has been disturbed, and you are like sweating, and there's the
Correct.
sleep is getting disturbed and all.
Mm.
So you should have a good sleep hygiene. You
Mhm.
sleep at a consistent, I mean, you make it a consistent time. You're sleeping at the same time, you're waking up at the same time. Okay.
Mm.
Not that you're sleeping at 2 o'clock in the night and getting up at 10 o'clock Monday, and then you're sleeping at 10 o'clock in the night and getting up at 8 o'clock. That
Mm.
won't help. Have a
Mm.
consistent time. And most important thing that women nowadays do, sometimes I do too, no screen time before sleeping, at least 2 hours.
Okay.
2 hours before sleep, you should not have a screen with you. Okay. The light that comes out of it, the blue light, you say, that keeps you active. So don't have your phone near you. Okay. Have a good book. Okay. Nowadays, reading books, Kameshwari, has become like a, novelty. People don't read the books only. Everyone,
Reading
whatever.
also, it has become in the mobile only now.
Sorry?
Reading also, it has become in the mobile only.
Yeah, I know, right? Everything is the, but when you really take a book and read, that is
Correct.
a different thing. I think that is a very, very, what you say, soothing and very interesting thing. So read a
Correct.
book, have a hot bath, okay, before you sleep. If you
Yeah.
have a tub, you can soak yourself in warm water. If you don't have, you can always take a nice warm shower. Have a glass of milk or skimmed milk with a little honey. All these things help you. If this is also not helping you out, then there is melatonin, but it really helps. And then there is magnesium glycinate, which you can take, and you can meet your doctor and talk to them. According to you, your problems will be solved according to, they'll be tailor made for you. Okay. So
So
now the
more
next,
sleep is also an issue here, ma'am.
sorry.
Sleeping more is also an issue.
Yeah, sleeping more. See, if you've always slept 4 to 5 hours per day, in menopause, you'll not sleep 8 hours. Okay.
Correct.
So definitely, whatever your body is used to, at least you should sleep that much. In your 30s, you're sleeping for 7 hours. You should at least sleep for 6 hours. If you think that I will sleep for 10 hours, you will not be able to sleep. Okay. Also, that because of the progesterone being low, like that calming kind of sleep and all, rarely it comes. But once in a while, if you feel like sleeping more, I don't think there's a problem in that. Okay. But thinking that I'll sleep more and I will get happy and my depression will go away, no, it won't happen that. In fact, when you sleep more and wake up, you feel more, you feel more tired, you feel more lethargic. So it's better to make a consistent time. If you're a working lady or if you're not non-working. So many a times I feel when I say this, maybe it is not related to our topic, but non-working women, when we write down the profession, when we are taking history, they say, the husband says, I'm an IT professional or I'm doctor, I'm this. My wife, no, she does not do anything. She does the most. She does the most. She is taking care of the whole house. She's taking care of the food, the clothes, the children, their tuitions, their studies, everything. So a non-working woman is more stressed out than a working woman. Sometimes when I am off and I'm at home and there's so much work, I feel, oh, it's better I go for work. That kind of feeling comes, So definitely, whether it's a working woman, non-working woman, everyone has to have a consistent time of sleep. Okay. Once in a while, you go to a party, you go somewhere, you're getting late. That is another thing. But consistent time will help you. The next is bone boosting nutrition. Boosting nutrition, mostly it's better that you go for food that contains more of calcium. You can also take calcium orally, calcium tablets orally, but calcium will not be absorbed if vitamin D is less. Kameshwari. So vitamin D has to be adequate. So nowadays there is a new thing that we have seen as doctors, and you must have seen in your profession. We have many Chat GPT and Google patients. Okay? People read everything and come and say, Doctor, you did not say this. Doctor, you did not say like this, or maybe like that. I just want to tell. So what they do without consulting the doctor, they take the medication. They take vitamin D without consulting. They take calcium without consulting. I just want to tell you all that there is something called hypervitaminosis. Okay. So if your vitamin D is adequate, but you are going without consulting a doctor, you're going and taking more and more of vitamin D, it increases. Okay. And there's something called hypervitaminosis, because of which there are other kind of symptoms. The patient will have different kind of symptoms. So getting doing good to you, it's doing bad to you. So it's always, if you want to take supplements, go to a doctor. Get yourself checked, get your B12 checked, get your hemoglobin checked, get your vitamin D checked. And according to you, the dose will be adjusted. Some people have very low vitamin D because mostly what we are doing, Kamish, we're getting out of your car, coming into work, and then sitting in your car, going back home. Okay, where is the sunlight? There is no sunlight. And then we have this excuses, so, oh no, we're getting late for work. Oh, get up a little early. Okay, walk to your car 5 minutes and go. And it goes for me also. Sometimes I'm also like that. We have to. Okay, the sunlight that we get is important for natural synthesis of vitamin D. Okay, but for some people it's very low. We give them injections. For some people, okay, with tablets, 1 or 2 months, they might come up to that level. So only if vitamin D is good, you get good calcium. Okay, so this is a bone boosting nutrition.
Okay.
Now we have dealt with nutrition. Sorry. Yeah.
Okay.
Nutrition, now calcium-rich foods, vitamin D, fruits and vegetables, lots of minerals. You have to take fruits and vegetables, calcium-rich foods we just spoke about. So all these foods that you see on the screen are important. The probiotics, the prebiotics, selenium, vitamin D, antioxidants, which are present in most of the vegetables that we take. Potassium is there in the banana, and the protein and all kinds of meats, and then the soya and all that. Omega-3 fatty acids. Omega-3, it's present in flax seeds, it's present in nuts, in fish, chia seeds nowadays. Many people are opting for chia seeds and all. That is also one very good thing. Omega-3 is actually a very good thing for the body. It not only makes the inflammation in our body comes down, but also cardiovascular health. For the cardiovascular health also, omega-3 is very good. So try to increase omega-3. If you see a Mediterranean diet, okay, in that there is nuts, there is fruits, there is omega-3. So you can also try the Mediterranean diet. But like we have spoken about fancy diets, not kind of a fancy diet, but yeah, these things are included. Prebiotics. And plant estrogens, we'll talk in a little detail. Prebiotics, probiotics, these are important things, okay? They help you to deal with gut health. Gut health is very, very important. The curd that you take, the buttermilk that you take, that we as Indians, we should talk about our diet. So nowadays, Greek yogurt has become very important. But what is Greek yogurt? It is the curd without the watery content. Okay? Greek yogurt has become important. All these things contain a lot of calcium. Okay? They contain calcium.
So, as you said, it is calcium. Some people say that body will not absorb calcium from milk. Is it true, ma'am?
Not absorb calcium from?
Milk.
No, see, calcium can be absorbed from any dairy product as long as your vitamin D is good.
Okay.
Okay. So maybe there is as much as calcium is needed is not there only in one dairy. You have to take different kinds. You can take eggs, you can take curd, you can take milk. So many things that contain calcium. So just having milk and saying that, oh, I had my glass of milk, my calcium is done. No, it's not like that. Unless your vitamin D is not good, you cannot absorb calcium. Either it's from milk, it's from curd, from eggs, anything. Okay. And then plant estrogens. This is an important topic.
Okay. So we have a question here, ma'am. Swati Himaja is asking, I got my gallbladder removed a year back, and since then I have bloating and constipation problems. So if I eat dal, then I will get bloating problem?
Yeah, so that is something your gastroenterologist can look after. But gallbladder, like it helps in the absorption of fats and all the enzymes that come out of it. But then definitely, like, if you have bloating with something, sometimes, what happens in our lifestyle earlier where we do not have problem with certain things that you've taken in your young age and all. Later on, when you take it as you grow older, that do not get absorbed. Okay, you have that bloating and that heaviness and all like that. Could be because of removal of gallbladder, you never know, but it can also be because of other reasons. Your gut health is not as good as it used to be. So first make your gut health better, and then you can absorb or you can eat things that are causing bloating and all. It won't happen anymore if your gut health is good. So try to take more of pre and probiotics, and anything further because you've had a surgery, it's better that you consult your gastroenterologist before you try a new diet. Okay.
And also she's asking that she's in her 40s and my metabolism decreased and I am gaining weight.
Yeah. So Swati, you said, right? Her name is?
Yes, ma'am. Swati.
Hi, Swati. So I just want to tell you that I have just done the slides about on the weight gain and slow metabolism. With a good lifestyle, you increase your physical activity, okay? And you eat foods. There are some foods that increase the metabolic rate also, okay? Like green apples, this and so you change your diet, okay? And proteins, okay? And all these things will increase your metabolic rate. So proteins are very important. Commonly, you can get it. If you can't eat dal, you go for some other kind of protein. Okay, if you're a non-vegetarian, you can go for lean meats and all. If you're a vegetarian, you're not able to eat dal, you can take soya chunks, you can take paneer like that. And important thing that unless you get your lifestyle change, your metabolic rate will not come up because of lack in estrogen. Already your metabolism is going down. And if you don't do something for it and you expect that it will come up, it won't. if you have a good lifestyle, if you have a good nutrition that increases your metabolic rate, definitely you will have a better metabolic rate along with your weight. You see that your weight is decreasing. Okay. So Kameshwari, I wanted to talk about phytoestrogens. Okay. So they are when some women have more exaggerated symptoms than other women when they are undergoing menopause, the hormone, that is the time we think of hormone replacement therapy. She comes and says, I cannot take this hot flushes. The way I'm sweating, I cannot work. It's like, actually, that disturbs their daily life. So such patients, we think of giving hormone replacement therapy, which has its own pros and cons. Okay. It's not like something, okay, you're having this, you just take this. We can't say like that because HRT comes with its own risk factors and all. So I'll talk about it later, but phytoestrogens is something that I wanted to talk about because these are naturally occurring substances in plants. They are compounds that are present in plants that mimic estrogen. They are not like human estrogens, but where the structure is very close to estrogen. And the good thing is that they go and bind to our receptors, the receptors of estrogen in our body. Now we don't have any more estrogen in the body. So this go and bind to the estrogen, loosely bind, but they also have that, they get down the symptoms, okay, without having a risk. Like if you take HRT, definitely it's a estrogen that you're taking, and definitely the like symptoms will be quite reduced. But if you take phytoestrogens that are naturally occurring compounds which mimic the estrogen, they are safe, and you can take it, and they are available in so many things in our daily life, like chickpeas, soy milk, flax seeds, and sunflower seeds, tofu, beans. Then there is edamame. Nowadays, a new thing has come. Edamame has more of protein, and tempeh, and all these things they contain. And sesame seeds. Sesame seeds is something every Indian woman uses still. Okay, you put it in gravies, you put it when you fry something, you put it on dosa, even you put it on so many things. Sesame seeds also have phytoestrogens, so please include that in your diet. So these kind of naturally occurring estrogens are safer to use. They mimic estrogens and they get the symptoms down. Okay, yeah.
So these seeds are to be soaked and taken, ma'am, or else at
Chickpeas and all
any
that.
form we can take them.
Actually, chickpeas, you have to soak them.
Okay,
Without soaking, we can't
correct.
eat. And tofu, definitely, the form it has come in. Beans, you can just make a like khichdi kind of thing out of it and have it. And soy milk is also available ready-made nowadays. And flax seeds, if you grind them a little and take, I think it is better. And sunflower seeds, now it's coming in flavors also, like salty, spicy. So I don't like the raw. I like it little spicy. So I buy the spicy sunflower. So, and almonds are also very good source of, and you know that our mothers, long time they want us to eat almonds somehow. Have almonds, have almonds. So we always ignore it. Okay, what the hell? I mean, what is this? The almonds. But then almonds help you a lot because, okay. And because these are things commonly available. If you ask people to take some fancy kind of things that are hard to get, they will just ignore the whole thing. Almonds are easily available. Sesame is easily available. Soy milk is ready-made. Tofu you can get. Beans. All these things are easy. And chickpeas. Okay, everyone in the house likes chole. Everyone. So boil something for yourself and eat it. It's going to be good. Exercise. I just want to tell you the importance of exercise. Walking is very, very important. Okay, it not only increases your metabolic rate, but it also helps your muscle mass and your bones to be healthy. Yoga is a beautiful form of Indian exercise. It calms you down and it helps you in your sleep. It makes your body more flexible. Okay, it will help you in many ways in your life. Include yoga, include walking. Strength training is very important. From 45 to 55 years of age, some kind of strength training, whether you do it with weights, you would do it with bands, or you do it with your body weight. But and nowadays, Kameshwari, people are not very oh, how to do this, how to do that. Just Google, they just put it on that. How to? So many videos come on how to do these. Exactly. So many times I even cook looking at the YouTube, and so many times it comes out good. So strength training, you can see the videos and you can do it. Okay. And pelvic floor exercises. This is an important thing. Like I told you, the tone of your pelvic muscles, like your vagina or your bladder, it comes down as you age because estrogens are coming down. Okay,
Correct.
because of this is laxity in the vagina, and then there is also your urinary bladder, urethra, everything is like lax now. And then you can't control your urine, you can't control like stress incontinence, like you're coughing, you're having some urine coming out, you're like by the time you go to the washroom you feel you've passed some urine. So these kind of things, like can, I mean, you can do much better if you do these pelvic floor exercises. How to do the Kegels exercises? You have lots of videos on it. You have lots on the social media how to do the Kegels. That will really help you to increase the tone. Okay. And there is a very important thing, Kameshwari, which is seen, that the prolapse of uterus. As you age, the uterus, it comes out of the vagina, it hangs out, and all these things also help in that, because women, normal deliveries and all, already the woman is prone to have the prolapse of uterus. And doing this Kegels exercises, they are very, very easy exercises. Even after childbirth, you are advised to do it. But in menopause, it's always good because you have more laxity now. Okay. So you can do the Kegels exercises. That is important and it will help.
Okay.
And these are 5 ways how to protect your bones. So balance your hormones by working out and all that. Eat foods that promote bone health, that I've told you, foods containing calcium and vitamin D supplements and sunlight. And smoking, alcohol is a no, a total no. Okay. Some people say, I just had one, today was a party, but that one goes to two and then it goes forever. Please stop it. Stop the alcohol, because see, your body, you yourself is very important. Okay. Certain things you can enjoy till a certain period of age. After that, you can't. Okay. So then you have to stop the alcohol because it's going to do bad to you. And the smoking also does bad to you. And then exercise regularly. Exercise should be a consistent thing. Okay. And reduce your caffeine intake. And then mental wellness. This is very important. We already spoke about it. You should have a good set of friends you can go and talk to. You should have support groups. You can have people around you who understand you. Okay. If all this is said and done and still you're feeling very depressed and all, there is something called cognitive behavioral therapy. Okay, where you can go to a counselor. So it is a very positive kind of program, and it's a psychotherapy, goal oriented, which will help you to like overcome your depression. So if you, even after meeting your friends, your family, this, you're not coming out of the depression, cognitive behavioral therapy will help you. And relaxation techniques, like we have spoken about the hobbies and all, if you take up the hobbies, and meditation is very, very important. Meditation and social connections like support groups, friends and all will help. And this is something that is a very nice picture, so I put it there. The hormonal changes, regular exercise, cognitive behavioral therapy, and emotional support. Okay, so probably we are running out of time, so I'm not going into.
Correct. No problem. We'll discuss all this in another session.
Yeah, the sexual health. The sexual health. So can I take 5 more minutes, or can I take 5 more minutes, or is it? Yeah.
Yes, ma'am. Yes, ma'am. Continue, please.
So sexual health is important. There are many vaginal lubricants, hormonal replacement therapy, and safe sexual practices and counseling support. So hormonal replacement therapy is something that you give estrogen, progesterone from like outside. I mean, you can be given in tablet form. It can be gels, it can be sprays, it can be vaginal rings and all. But hormonal therapy comes with own side effects that patient may be prone for cancer risk. There is a cancer risk. Like in the patients who have already had a hysterectomy done, we give only estrogens, and then they might have a risk of breast cancer. Whereas when we give estrogen, progesterones to women who have the uterus still intact, they have a risk of endometrial and ovarian cancers. Okay, so it is always better that given to a patient who really needs it, and the rest of the ones can go for the phytoestrogens, lifestyle changes, and all. Okay, and sleep hygiene we spoke about. Okay, hormone replacement therapy, I told you the risk: strokes and blood clots, breast cancer, endometrial cancers, and gallstones. And when to see a doctor. Like, having said all this, when to see a doctor, this is the question you asked me. If there is bleeding after menopause, like how your grandmother had it, then severe pelvic pain, sudden urinary problems, breast changes, any lump or anything you feel in the breast, better to go and show. And persistent depression and anxiety needs to be shown to a counselor, psychiatrist. Very heavy bleeding, it has to be dealt with because there might be other problems like fibroids and polyps or other things. And we can't just leave a woman bleeding thinking that's just a heavy period. Okay, she might have anemia or something. So that is the time you have to see a doctor. So the take-home message is healthy lifestyle ensures healthy aging, early screening, regular gynecological checkups, and this period of life is a special period. I would like to say to all the women watching out there, this is a very beautiful, graceful phase of your life, a very special phase of your life. This is the time that you have to think about yourself. You have cared for your children, your family, your parents, your partners, their parents, your in-laws, everyone. Now is the time to think of yourself, okay? Take a step up, look after your life, make your own rules, enjoy your life because you are precious, okay?
Yeah. So we have a last question here now. Mrs. Martha is asking, I am 48 years old woman, travel daily 3 hours journey, come home with stress, getting 6 hours sleep, periods are regular, my daily activities are becoming slow.
Periods are regular, but daily activities
Yeah.
are getting slow. Yeah. So it's not necessary that you have your estrogens are all not fluctuating or you've reached 40 years of age, your metabolism is coming down. So as you age, definitely your metabolism comes down, you are aging, your bones, your muscles, your energy is not the same. Okay. So again, lifestyle and food habits, your nutrition and your lifestyle definitely will make a lot of change. Even if your periods are regular, you need to exercise, you need to walk, you need to do strength training, you need to have a very good nutrition, prebiotics, probiotics, a very good group of friends. This will all add positively to your well-being.
Okay, thank you so much, ma'am. So this is the time for conclusion. Viewers, hope it was a very, very good session for all the women all over the world. So during conclusion, I would like to repeat the main key points, which are perimenopause versus premenopause. Estrogen is most important hormone. Hypothalamus, hot flash comes. Counseling for family members, which is very important. Osteoporosis, insulin resistance, good lifestyle, hypervitaminosis, gut health should be best pre and post menopause. Phytoestrogen foods, which have already madam has explained very well. So exercise is mandatory, and consultant of a doctor and taking medications and all other treatments is very important at this stage. And maintain good friend circle, and just make your life chill as you can, as possible as you can. So we would like to thank Dr. Sophia here.
Thank you so much, Kameshwari. I enjoyed the session, and the list that you have made shows that you are going to be a menopausal counselor now. So you have really taken down the key points.
You have taught us very well, ma'am. So that
thank you so much.
It has been injected in our brain now.
Thank you. I want to thank all the women who joined, all the males who joined. Take care of your mother, your sister, and your mother and your sister, and all the women in this stage. Be patient with them. Love them because they've loved you all their life. And to all the women out there, so please enjoy this period of your life and good luck, and take a step towards your lifestyle, good nutrition and diet, etc. So take care. I hope this was helpful. Good luck to all the women. We are proud of each other. Thank you very much. Bye-bye.
Thank you so much. Thank you, viewers. So next session will be a more interesting one. We'll see you again.
Thanks for this opportunity.
Thank
Bye-bye.
you, ma'am. Thank you so much.